Hello and welcome to our Euro Health podcast. My name is Jiří Svoboda and this is season 3. With us today is Viktor Mravčík, Head of Science at the Institute for Rational Addiction Policies and advisor to the Czech National Drug Coordinator. Doctor, welcome.
Hello.
So it's great to kick off a new season with you. Our topic today are drug policies. You headed the Czech National Monitoring Center for Drugs and Addictions for almost 20 years. I was wondering, just to kick it off, how did the drug policies develop in that time? What is the direction we took?
Interesting. I left the position
in 2021.
In 2021 in November. I was there since 2002,
Yes,
so
yes.
Almost 20 years. When I look back, there is a big difference between how I started in the office of the government, because the monitoring center is part of this coordination structure within office of the government, coordination structure for the drug policy in Czech Republic. Basically, there is the council of the government for the drug policy coordination. There is a secretariat for this committee, which is basically one department in office of the government, and part of that is the National Monitoring Center. And I would say in Czech Republic as well as elsewhere, at global level, European level, drug policy has changed. Basically, since 60s, 70s, or in 70s, there was a strengthening of the drug policy with the Nixon initiative, and then the Reagan and USA policy of zero tolerance and war against drugs, basically, which somehow influenced the global drug policies and the national drug policies also in Europe and Czech Republic. So it was more focused, or I would say more emphasis was given on restriction on law enforcement, at least when it comes to the psychoactive substances controlled under those UN conventions, right? But I should say that Czech policy from its beginning, at the beginning of 90s, was always rational, balanced, with public health emphasis and strategies with harm reduction always being there. So we are in a sense, and we were kind of always in front of those trying to really do the evidence-based rational things in drug policies, and we continue with that. There were some interesting changes, for example, integration of different topics into one policy. So not only it started with illicit drugs, but gradually, since 10 years ago, we have integrated alcohol, tobacco, and nicotine. Gambling and other addictive issues or topic, or how to say that, into basically one policy. And with that, we integrated also monitoring, which I was responsible for.
Quoting the name of the institute you are part of, did the policies become more rational in that sense? What does it actually mean that policies in drug harm reduction become more rational?
Yeah, means basically it should be more based on the facts, on the evidence, also on the experience, what works and what not, less on the ideology, on the chimeric idea of world without drugs, without nicotine, without alcohol, which is really chimeric or too idealistic, and we should be more pragmatic, more based on what works, what not.
Quick follow-up, because nowadays you can hear quite a lot of people, politicians, speaking about this, trying to build like zero nicotine generation, for instance. Would you say these ideas, these proclamations are way too idealistic and unrealistic?
Well, it's simply, if it's too extreme, it's too much. Of course, we should look at the balance between the law enforcement and control and I would say limitation of the supply or restriction of the supply and the human rights and personal freedom, personal choices, and I mean personal choices of what people think is best for them. And
even though they might be completely wrong.
Yeah, even if it might be some harms associated with that. So, and we should look at the balance, and the balance is in between no restriction, full liberalization, we can say also of the supply, and complete restriction, prohibition, and we should look at the solution in between.
Let me stop at one particular substance, or rather a group of substances, because there the approach of Czech government has been kind of restrictive because it's a new substance. And I'm speaking about HAC and kratom. It's a new thing that just spread it around the market, and the Czech government has been very quick in restricting the supply, of trying to restrict the supply as much as possible at this point. So doesn't this go kind of against the so-called more liberal harm reduction approach?
I would say it's complex. It's more complex. First, we have in Czech Republic, and the process started 2 years ago. We have initiated establishment of completely new legislative framework, a regulatory framework for this type of new substances. We call them psychomodulatory substances. Yeah. It's completely new term in a field. We had to invent this term in order to label completely new category of products to be marketed for the human consumption as psychoactive substances. So in this regard, or also in this regard, Czech Republic and Czech drug policy is very innovative. Yeah? It's pioneer in this because, as I said, for 70 years, the predominant solution how to deal with those substances is the prohibition or prohibitory or punitive prohibition with the strong consequences in the criminal law. And till now, till kratom came and those new cannabinoids or semi-synthetic cannabinoids came, also in Czech Republic, the predominant response was to put those substances on the list of those controlled, forbidden or prohibited substances, to enlarge those lists. We call them schedules, and simply put them to the list together with heroin and methamphetamine and so on and so on. And this is a dead end, simply. But the governments, and this is the problem of all the governments in a world, and in this regard, we propose as Czech Republic, we show there is a solution, alternative solution. And governments are in difficult position because they have a dilemma of no response, to let it be, which is also extreme, which should be avoided, or to simply prohibit it, to put them to another extreme. There is nothing in between. There is no possibility because those substances can't be regulated under the alcohol regulatory framework, tobacco. It's simply closed for other substances. The food regulation is not good for this as well. So it's simply new regulatory framework has to be created. This absence, this vacuum, as we call it, has been the main problem of the drug policy and the regulation in psychoactive substances in the last many years.
So this harm reduction approach, which is in general very much seen in the Czech legislation, and as you said, Czechs have become kind of a pioneers in it. Would you say that this approach is successful more than the restrictive and strict prohibition policies?
Yeah, there is plenty of evidence indicating that conclusion. First, there is no evidence that the prohibition is only or the best solution how the society should deal with the psychoactive substances, right? And on the other hand, there is plenty of reason how this prohibitory approach is harmful for the health, public health, society, security. It simply stimulates the illicit market, which then stimulates the different drivers, corruption, black economy, and so on, which threaten the rule of law, simply the democratic system, democratic state. So, I mean, fueling or strengthening the prohibition basically is also controversial or against these principles and outcomes.
So the biggest restrictions in fact become the reason why the state loses sense on what's happening with the drugs, right? It's the completely different outcome than the government hopes for.
Yes, exactly, because prohibiting doesn't mean what's the English term? Simply getting rid of the substances. They are existing, the supply is existing, but completely on the illicit part of the market, which can't be controlled by the standard regulatory democratic processes, principles. Yeah, so this is it, and then. Government has, in this prohibitory regime, government has a lot of expenses to simply enforce the prohibition. But there are the expenses are high. There are also high social costs on the side of health and social consequences and so on. But the profit, if there is any, and there is high profit in some substances, is on the illicit side completely without any advantage for the public budget. Some
could say that so we have implemented quite a bit of these harm reduction, more liberal policies, but despite this approach, Czech Republic still has about 20% of the population over 15 years of age smoking. We have a high reputation of high alcohol consumption, production of a lot of hard drugs as well. Isn't this argument to be more restrictive in the policies, in fact?
No, it's an argument. Exactly, it's an argument for the consideration of the smart solution or smart solutions or reasonable policies in between those extremes. You exactly pointed the problem. Alcohol and tobacco are on the side of very liberal marketing and the supply. And there should be more adequate regulation for those substances in order to decrease the associated harms. And on the other side, those substances who are prohibited, again, has to be shifted or moved to this space of the reasonable regulation as well. Yes.
So
And what is interesting, because as I said, despite this prohibitory basis for the majority of substances, the Czech drug policy has always been reasonable or rational or balanced, and so harm reduction was always there. Yeah. So, for example, we have a quite high accessibility of harm reduction services for users of so-called hard drugs and the people injecting drugs. Yeah, we have syringe exchange programs, substitution programs, even if there are gaps in the accessibility. We are implementing in recently also some innovative interventions like naloxone programs, like drug consumption room, which has been opened just recently in Brno. So, and thanks to those harm reduction programs, consequences of those hard drugs are very low in Czech Republic. If you compare, for example, mortality, we have associated every year in Czech Republic from 15 to 20,000, around 80,000 deaths associated with tobacco. So it's like 1/5 of all deaths in Czech Republic, almost 1/5. Yeah, it's big. There are 6,000 deaths associated with alcohol annually, which is again very high number. And we estimate there are maybe not even 500 deaths associated with other drugs, illicit drugs, like heroin, pervitin, cannabis, and so on and so on.
Okay. So if the harm reduction policies work so well, and we have the evidence for it, why are some politicians in some countries are still very much opposed and still decide to go more in the restrictive approach? Is it just ideology, or what's happening there?
Yeah, ideology is there from the beginning. And as I said, with some campaigns in 70s, 80s, it was even strengthened. This securitization of drug policy, when the problem, which is in principle public health, is presented and at political level dealt, or how to say that, as the security problem. Which in principle is not. They call it also in research. How they call it? Drug crime nexus or something like that. Yeah, that simply
to try to put together
also due to this policy simply and it's presented as drug problem is presented as a criminal problem of criminal organizations, international criminal organization, and so on and so on. And then the logic answer, or following that logic, is the strengthening, the response, and also militarization of the response, which especially in Mexico, for example, in America, this policy led to the decrease of the health expectancy in Mexico due to so many deaths and so on and so on. So really this prohibition enforced by also military means, I would say, and this punitive prohibition with really high sentences. Also in Czech Republic, you can get years of imprisonment for the grams of the substances, right? So it. Now I forget what I wanted to say. At the beginning.
That's all right.
So simply, this is wrong. We should think about the drug policy in completely different way.
So when you work with international colleagues of yours, and they do have this kind of ideology-based approach, and they try to be more restrictive in the policies, what is the argument? How do you try to talk to them?
At international level?
Yeah.
You mean? Well, there have been times when it was very difficult at the international level, and especially at the formal meetings, I would say, under UN. Language is very important in this regard. It's kind of symbolic as well, but it helps us to understand the situation and then to find the proper responses. So there were years of the fight for for terms, like just to say harm reduction was forbidden in certain period and in certain audiences, I would say. Yeah, and I mean,
has it become easier in recent years?
Yeah, recently, as regards the illicit drugs, yes. So I mean, gradually, those innovative responses and the comprehensive view on the policy is gradually there. Yeah. So it's somehow easier. Just few months ago, in March this year, we have also the Czech Republic contributed to the again English term when this international society under UN simply adopt the resolution, right? Yes. So there is a first resolution with the harm reduction, openly saying harm reduction as the term, yeah, and
only a few months ago,
yeah. And Czech Republic contributed.
Wow!
So it's an acknowledgement of this principle also at this
level,
UN level. Yeah.
Mm-hmm. Mm-hmm. Well, a certain amount of tolerance and the harm reduction policy basis is also endorsed by European Monitoring Center for Drugs and Drugs Addiction, or EMCDDA. But as we kind of already outlined, some states are not really aligned. Some member states of the EU are not aligned in the way how they approach harm reduction. So what do you think can EMCDDA, or from this July European Drug Agency, what it can do? What is the main task of it for now?
Well, I would say first there are formal maintenance, or the corridor for EMCDDA given by the regulation of the agency, and they can't go beyond the mandate in the regulation very much. Yeah? So the main focus is on the illicit drugs, polydrug use associated with the illicit drugs. So there is an alcohol, but not as a main focus, yeah, for example. And with the recast of the regulation, there is more emphasis on the, I would say, market side, or this supply side of the situation. Yeah, so there is a strengthened, for example, EU Drug Agency should establish the network of the forensic laboratories and strengthen the data in this regard. But there is also, on the other hand, possibility to cooperate with the civil society and so on. But I would say, and this is not a problem of EMCDDA, and EMCDDA can't do anything with that, or just a little with that, is that the drug policy or substance-related policy at European level is fragmented, divided. There is this illicit drug policy, then there is alcohol, then there is tobacco, and gambling policy basically at European level doesn't exist. Yeah, so, and there are separately, formulated and coordinated and so on and so on.
There's a lot of work,
which is very problematic. Yeah, because this integration of the policies, which happened in Czech Republic 10 years ago, is very useful for anyone, for politicians, for decision makers to understand the situation and to understand the proportions of the problem. Yeah, in one framework, looking through the one lens, one eyes, so you can compare a problem related with alcohol, with tobacco and nicotine. You can use the same indicators to measure the extent of the problem and the nature of the problem and problems, yeah, in one framework. If it's divided, you can't see that. Yeah. And then you could do completely different things in this policy as compared with that policy. Yeah, which
is this something that the European Drug Agency, which is coming from the EMCDDA from this July, is this something that the agency can implement on the European level? Do you think it's the...
Not really. This is exactly the question of mandate. And it's limited the agency in this regard. When upgrading the mandate in the last, I would say, 2 years, and it was done under the Council of European Union, so member states were those who simply had the main initiative in this. So there was a substantial discussion on that. There was from the Commission, there was a proposal to enlarge the mandate based on the evaluation and also some advices from the member states. But at the end, there was no enlargement, basically, or not that much. Yeah. So, which I think is the lost opportunity, basically.
So, are we really far from a coherent response to substance addiction at the European level? You're saying that the policies are sort of fragmented. Is there a path, a way to make this more coherent and cohesive throughout all 27 member states?
It's only way to go for me. I think it should be the main agenda also of the new parliament in this field. And as I said, one frame can bring also more rationality in all the policies, and also in illicit drugs, there are signs of the more emphasis than I would like, more emphasis on the law enforcement, also when you look at the narrative coming from the Commission recently, it speaks about the fight against drugs and war against the criminal organizations and so on. So really, it's too much, to be really balanced and rational, and this integration could help very much.
One of the important initiatives that EMCDDA has is the European Conference on Addictive Behaviors and Dependencies. You attended that multiple times. I was wondering, does the scientific community the politicians community recognize the importance of the scientific progress? Is it easy to influence or talk with politicians within scientific evidence when you speak with them in these conferences?
Well, basically, you are referring to Lisbon Addictions, right? To this biannual, one of the biggest conferences, if not the biggest now in the world, in addictions. As you said, I was there from the beginning in the conference, and it really evolved in the very, beautiful event. With many people, with a lot of discussion on addictions, addiction policies, the new emerging problems, and so on and so on. But this is mostly scientific conference, So it's difficult to
transfer that into
directly for politicians, of course. Any decision maker who would like to be informed about what's going on in addictions should take part in the Lisbon Addictions to simply get information on what's going on. But it's difficult. It's really scientific. So and I would say it's not only for this conference, but in general, this translation of the scientific evidence for politicians and into the policy and evidence and knowledge is a discipline as such, I would say. So it's not that easy simply to pass it through.
Did you, for instance, see that the European Commission would in fact acknowledge the scientific progress and work with scientific evidence in the preparation of the new policies, or is it becoming maybe probably too difficult to actually speak with politicians in, as I said, like in scientific terms and with scientific evidence?
Well, in Europe, it's as regards the illicit drugs and the drug policy in this field, EMCDDA is the main, I would say, center of excellence of the evidence and knowledge in Europe, and it's closely cooperating with the Commission. Yeah, so thanks to EMCDDA, thanks to EU Drug Agency, there is a solid basis for the drug policy in Europe, I would say. Yeah. So it's very good.
Okay. And how does the European Commission play the role here? Is it helpful, or is it difficult to work with it in terms of EMCDDA and the Commission collaboration?
Well, Commission has more, and I would say increasingly, I'm not expert in the EU, I would say internal processes and so on, but I would say increasingly role, there is an increasing role of Commission, also in drug policies. Even if the adoption of the EU drug strategy is the main responsibility of the member states, Commission plays increasing role and has can have its own initiatives, which are somehow following the strategy, which I would say might be problematic, as I said before, with the recent emphasis on this law enforcement.
Well, after elections, which are coming in less than 2 weeks from now, but to je blbost, to vystřihám, protože to půjde potom. Well, after the elections, the European Commission will also revisit the Tobacco Products Directive. The existing directive covers traditional cigarettes and also some of the new one, like e-cigarettes, and imposes kind of severe or very severe restrictions. And so what do you think of the European Commission's approach to this? Is it going to be rather a continuation of the more traditional restrictive approach, or do you believe that Commission will in fact impose more of the harm reduction and liberal policies?
That's the question. I expect really tough discussion on that new or recast or upgraded tobacco regulation. We should acknowledge that the main international frameworks means at the UN level this framework convention on tobacco control, and at European level this tobacco control regulation simply don't cover or don't include, don't acknowledge enough or at all those alternatives. The Tobacco Control Directive covers traditional tobacco and traditional cigarettes and e-cigarettes, but not those heated tobacco products and this oral. And moreover, this Tobacco Control Directive restrict or doesn't allow marketing of these low risk products as snus. Just it's possible just in Sweden because there is an exemption for Sweden. So it's paradoxical situation. It allows marketing of the most harmful product, classical cigarettes, but restrict much less harmful products as like oral tobacco. So we should change that, and I think both the global and European frameworks should acknowledge this new development in nicotine and tobacco products and acknowledge this harm reduction principle.
can we speak about this in a bit of a more detail? So you mentioned the marketing should change, or like the rules for marketing should somehow change. What are the other harm reduction policies in terms of tobacco products that should be implemented in this new regulation?
Basically, this is the core.
Mm-hmm.
Yeah? Simply acknowledgement of those alternative, how you call it, alternative products or products with modified risk. Yeah, it's also the term used, yeah? And there are many of them nowadays. In times when the regulation was prepared and the framework tobacco control the convention was prepared, there was just almost predominantly the tobacco. I mean, combustible tobacco. Mm-hmm. Yeah? Now the situation is much heterogeneous, I would say. Mm-hmm. Yeah? And the products differ very much according to their risks. Yeah? So we have a classical cigarette and the combustible tobacco as such, but we have electronic cigarettes of different kind. We have heated tobacco products, which are similar to electronic cigarettes, but contain tobacco. We have different oral products, like nicotine pouches. And so on and so on. Yes, so and all of them we can, place on the continuum of risk, showing or acknowledging that there are products with the very high risk and very high harms associated, but there are also products with the very low harms. Of course, it's complex because there are different, I would say, risks for smokers who would like to quit the smoking and simply are not ready or able to quit it completely. So the shift to modified risk products, to less risky products is the best alternative for them. But there are also non-users of the nicotine or tobacco who are exposed to the marketing of those new products, and for them to start using even those products with low risk, it means increasing the risk and including risk of addiction. So
it's a difficult issue.
It's complex, but anyway, it should be acknowledged, and there are countries in also Europe trying to integrate this into their policies, including smoking cessation policies, like UK, for example, which has the recommendation of the transfer from classical cigarettes to electronic cigarettes as an official part of the smoking cessation guidelines. Yeah, so
also an interesting way to go. Just to wrap it up, so as we already mentioned, EMCDDA will become the European Drug Agency and will gain perhaps more powerful position. What do you envision for its future? What would you say are the main priorities for this agency? What should it cover in, let's say, a year's time?
I think that it's an opportunity for setting the agenda for the recasted drugs agency. So to say, we are here, we have changed. We have changed not only the name, but also we are taking the responsibility and we are setting the agenda. These are the problems for EU, and we would like to follow them. Yeah. So I guess there will be focus on this heterogeneity in the psychoactive substances. So this new psychoactive substances is the phenomenon of the last years. So I think it will be emphasized in kind of launch of this very or upgraded agency. Yeah. Then what? I would say I expect also because this public health aspect is in genes of the agency. Yeah. Also, when you look at the experts working there, they are not only law enforcement experts, but historically public health people who takes care of the health consequences and also responses to address them. So I would expect there will be also, I would say, a reminder of those harm reduction interventions and strategies. Also to address the changing reality and changing supply of different substances. Yeah, innovation will be also a keyword. I would say. I would say calling for the innovations not only in monitoring but also in the policy. Yeah.
That's it. All right, Viktor Mravčík, thank you very much for your responses and a great interview.
You are welcome. Thank you for inviting me.
And this was the first episode of the third season of the EuroHealth podcast. Thank you for listening to us and follow us for more.